Dr. Sreeja Sreekumar, Psychiatrist at MOSC Medical College, Kolenchery. Every year on May 24th, we observe World Schizophrenia Day. Schizophrenia is a serious mental disorder in which the person's thoughts and experiences lose touch with reality. It results in a combination of hallucinations, delusions, and disorganized thinking and behavior, which affects the functioning and can be quite disabling. Schizophrenia is a neurodevelopmental disorder which appears in the late adolescence or the early adulthood, and it can affect about 1% of the population. This is a disorder affecting the brain, and it can occur because of imbalances in the neurotransmitter system or the chemical composition of the brain. Genetic factors, family, social and environmental factors, as well as infections during pregnancy can contribute to the development of this disorder. Symptoms of schizophrenia can be assessed by observing the behavior, thought process, emotions, cognitive and social functioning of the individual. Schizophrenia being a psychotic disorder, there is a split from reality, and it can be quite difficult in that whatever the person experienced while being psychotic is real in their mind. So whatever they are hearing, seeing, smelling, feeling and touching are real in their minds, and you cannot convince them otherwise, because what they were experiencing were true in their reality. Symptoms of schizophrenia can be viewed as positive symptoms and negative symptoms. Positive symptoms does not mean that they are good symptoms. Instead, it means that it is the presence of or addition of some of the symptoms like hallucinations, delusions, disorganized behavior or thinking. Hallucinations occur when your senses perceive something that isn't really there. It can happen with any of our senses. For example, a person may hear voices when there is nobody around. That is known as auditory hallucination. Likewise, a person may be able to see images or people who are not really there, which is called visual hallucinations. Delusions, another positive symptom, is strongly held false beliefs. Persons who experience delusions may be having strongly held beliefs that they are being persecuted. For example, like a group of people or a person is trying to harm him. Besides hallucinations and delusions, there can also be negative symptoms. Negative symptoms refer to absence of or diminution of some of the features that you previously had. For example, there may be flattening or blunting of affect, which means that your emotional expressions have reduced or diminished. There can also be social withdrawal, emotional withdrawal, lack of energy, lack of emotions. They are all negative symptoms of schizophrenia. Now, regarding the treatment of schizophrenia. Schizophrenia is a treatable condition. Effective treatment methods like antipsychotic usage, psychotherapies, and psychosocial care go a long way in the road to recovery. For this, you need to consult a qualified psychiatrist without any delay, because any delay in the treatment of psychosis can result in a poor prognosis. I can't say that there is a permanent cure for schizophrenia yet, and that recovery doesn't mean that you will never be facing any more challenges from this illness, or that you will never be experiencing any more symptoms ever. But recovery means that you will learn to manage this illness better, get all the support you need, and also satisfy the purposes of life. Optimism is important. Patients, family members, and mental health professionals need to be mindful of the fact that many of the patients have a fair course of illness and that challenges can be addressed. People with schizophrenia are often perceived as being dangerous. This dehumanizing stigma attached to the diagnosis can prevent them from seeking treatment. Therefore, it is important to educate the patients, their families, and their communities, thereby eroding the stigma and helping them access treatment faster and easier. Thank you.